Good day, dear students. In current lecture, we will discuss viral hepatitis. And first of all, of course, you should remember that not any liver damage is caused by viruses. We have traumatic injuries, we have poisoning, and some protozoa and worms can damage liver. But one of the most frequent reasons of liver injuries or liver damage is, of course, infection caused by different viruses. And in viral hepatitis, it is a common practice to divide all pathogens into two main groups. It is oral pathogens and parenteral pathogens. So the classic example of oral hepatitis is hepatitis A, and hepatitis A virus is shown in that picture as electron microscope photo. And actually, we already talked about that family of picornaviridae in previous lecture when we discussed poliomyelitis. And hepatitis A virus belongs to the same family, so actually the structure of the virus is the same, and only genus is another. It is a hepatovirus, not enterovirus as polio. And the only species causing disease in humans is hepatovirus A. So as well, it is one of the smallest pathogens, and as you can see on that photo, it is extremely small particle. So in different amount, but cases of hepatitis A infection are registered worldwide. We have some area which are hyperendemic by hepatitis A. In our countries, that disease is not very frequent, but still some number of cases are registered annually in both countries. So in general, in worldwide scale, hepatitis A is one of the most frequent reasons of foodborne infections and infections transmitted through oral way. And actually, almost every episode of disease is associated with low hygienic measures, with low quality of drinking water available, and poor sanitation measures. And again, a few years ago, some governmental person in India stated that actually the main goal of Indian future years is fight with street toilets. It caused some laughs and caused some disturbances in community, but actually measure is absolutely correct because a lot of diseases are related to poor sanitation and street toilets. So it is a good measure to prevent hepatitis A infection as well. So usually diseases caused by hepatitis A virus are mild or moderate, and very rarely they can be fatal. But again, we have some number of fulminant hepatitis or acute liver failure when lethal outcome is the only possible outcome of the disease. It is less than 1% rate, but still it is possible. And the major problem of hepatitis A is not a problem for a person, it is a problem for a government, because actually disease can be very long lasting, about a month or more. Person should be isolated and could not attend job, and of course that person will not perform any social activity, and government need to pay for treatment, pay salary, but person not performing any job. So of course it is only social and economical effect of the disease, which is important for highest authorities. And as far as hepatitis A virus is present in single serotype, so after one episode of disease, immunity is usually prolonged and lifelong, and only one episode of hepatitis A is possible during the life of the subject. So disease is transmitted from ill human, and again it is mainly fecal-oral route, through unclean water, through dirty hands, especially if it is a person working in food industry, and unsafe cooking and use of water from unknown reservoirs, unknown sterilized, non-clean, is the main way of transmission of the disease. So in younger kids up to 6 years of age, symptoms are very rare present, and mainly all diseases will be asymptomatic, and people even will not know that they were ill or their kids were ill. But immunity, if you will perform so many tests to check immunity, it will be present. It means that kid was already ill. So in symptomatic cases, disease usually started with acute onset of high fever, higher than 38 degrees Celsius, and of course, common symptoms of GI infection, a loss of appetite, nausea, vomiting, discomfort in abdominal area, maybe loss of appetite. And after a few days of common symptoms, subject will suffer from acute liver damage, and actually any viral hepatitis is caused by destruction of hepatocytes. Of course, virus will replicate in liver cells. After replication is finished, cell will be destroyed and cannot perform any function. And the main symptom of hepatitis is related to incorrect function of bilirubin secretion and excretion. And actually cells, hepatocytes, they should produce bilirubin and excrete it into liver ducts or bile ducts. And bile should accumulate here in liver, and during food intake it is secreted or produced, released into the intestine. And liver naturally have dark brown color that bile have dark brown color. It will be released into the intestine, and fecal matter is usually of brownish color because of presence of bile. And of course, amount of bile present in blood is very low, and usually some slight yellowish color of urine can be again due to bilirubin present. But in the case of hepatitis, liver cells are destroyed and bilirubin is not excreted into the bile ducts. It will be released into surrounding tissues. And of course, that blood will be absorbed by surrounding blood vessels, and liver is parenchymatous organ. It is rich with small blood capillaries. And that bile will be absorbed into systemic blood circulation. And actually, in any acute hepatitis or viral hepatitis as well, we have three main colored symptoms. We call it colored symptoms because color of something will be changed. So first of all, bile is absent in intestine because it is not released into the bile ducts. It is absorbed into the bloodstream. So fecal matter became pale, and in severe cases even colorless or white color because of absence of bile. As you can see on the center of the slide in the central picture, it is some example, some sample of fecal matter from hepatitis A person. And excess amount of bile, of course, will present into the blood, and due to osmotic pressure, it will be released into the skin and epithelium, into underlying tissues, and color of the skin and sclera mainly will be changed. It will become yellow. Of course, that amount of bile present in skin will cause chemical disturbance of skin receptors, and skin will cause severe itching. And actually, if it is a dark colored person, some races who have naturally brown or more black color of skin, it is difficult to identify jaundice of epithelium, but usually you need to check sclera because sclera is always white, and in the case of hepatitis it will become yellow, as you can see on the left picture on the slide, or palms, because again skin of palms is usually white in any race, and it is easier to see that skin is yellowish as well. And third colored symptom is we call it beer colored urine or dark colored urine, as it's shown in the most right picture. Urine became more brown because bilirubin will be excreted with kidneys. Of course, it should not present in serum in high amount, and it will be excreted by our kidneys, and color of urine will become very dark. So usually combination of three symptoms should tell you that it is some liver injury with destruction of liver cells. If you will perform blood examination, of course, you will see elevation of enzymes responsible for liver function, such as ALT and AST. And the same excess amount of bile present in underlying tissues can cause muscle pains and joint pains, or some kind of sensation of itching and disturbances in underlying tissues. To perform diagnosis of the disease, usually history and area of a person living or history of recent trip in endemic area should tell you that it is oral hepatitis A. but actually we have some tests, serological tests to identify IgM and acute stage of the disease. And in first weeks of the disease, while virus is present in the blood, you can take blood samples or stool samples, and of course, the PCR technique is the most popular and frequent way to diagnose the disease. For hepatitis A, we don't have any specific therapy, and usually treatment is symptomatic to release itching, to provide proper food, proper diet, to make absorption of food easier, because of course if bile not present in intestine, person will not be available to digest some fat products and complex food digestion products, and diet should be specific for the disease. And of course, if it is fever, then antipyretics. If person is difficult to drink, so maybe IV fluids to compensate lost electrolytes, especially if subject have severe vomiting. So only common measures we have to treat the disease. Again, prevention is mainly non-specific, and main number of countries don't have any vaccination programs for citizens. But common measures, proper disposal of sewage, drinking of only known water, cleaned, filtrated, or at least boiled water. And actually that's all what is possible to do. Washing hands as the main measure of any food infection. And we have vaccines, but again, mainly they are indicated only for people who are going to attend endemic area, tourists or doctors who are going to help people here. And of course, we have that post-exposure measure. If someone was in close contact with a person infected with hepatitis A, until it is incubation period, it is possible to provide vaccine for that subject to avoid severe duration of the disease. And actually, in immunobiological preparations for hepatitis A virus, you have only few systems. It is first ELISA kit. It is common set of immune-linked, enzyme-linked immunosorbent assay, the same plastic vials covered with anti-IgM or antigens of hepatitis A virus to identify acute stage of the disease in human by change of color in corresponding well. As we said, we have vaccine. Again, it's not available in any countries, but those countries who performing scheduled vaccination or planned vaccination. Again, vaccine is indicated only in kids some near to 2 years of age, but not younger than 1 year of age. And usually, first dose of vaccine is recommended from 1 year to 2 years in any period of life, and second dose after 6 months after the first dose. So 2 doses should be provided, and vaccine usually provides again lifelong immunity against single serotype of the virus. So if it is post-exposure vaccination, then again, of course, vaccine should be given in maximum duration of incubation period if symptoms are not appeared. If subject is already symptomatic, you cannot give a vaccine. It is already a disease. You can only give a treatment. But if subject became acknowledged that someone around is infected and you see that subject is absolutely healthy, no symptoms are present, then within 2 weeks after exposure, vaccines can be given in a single dose. Second virus causing oral hepatitis is hepatitis E virus. Actually, diseases are absolutely identical in duration, ways of transmission. Virus belong to another family. It is Hepiviridae and genus Orthohepivirus. Virus responsible for hepatitis E in human belong to species Orthohepivirus A. It is a little confusing because hepatitis E, but species named as A, but it is really so. So hepatitis E disease mainly limited to Asian countries. Here we have the highest prevalence and the highest significance of the disease. But actually, again, some cases, accidental cases of hepatitis C infection are registered worldwide. And of course, disease is possible in any country of the world. So as far as Asia have the highest rate of disease, recently China licensed recombinant vaccine against that virus. It is subunit vaccine, but actually they're not sharing that vaccine, and it is available only in China. They're not exporting it, and it is the only country when specific prophylaxis is available. Some companies are working on hepatitis E virus in other countries, but they're not approved for use in humans yet. So virus as well is present as single serotype, and we have 4 genotypes of the virus. So first 2 genotypes are usually causing disease in humans, and third and fourth virus are zoonotic, and cases of disease in human is low, but some, again, ability of virus to be transmitted from animal to human is known, and some diseases are registered. So similar to hepatitis A virus, usually diseases are mild to moderate. They are self-limited, not require any therapy, but in the contrast with hepatitis A, and we still do not know reasons and why it is happening so. But hepatitis E virus is extremely lethal in pregnant women, especially in third trimester, and mortality rate in them can reach 30% in different countries in different research. And the main reason is acute liver failure. So if in common community rate of deaths is about 3%, in pregnancy it is up to 30%. Of course, pregnant women should avoid any trips to the Asian region and avoid contact with people suspected to be with hepatitis. So virus is naked, genome is a little larger than in hepatitis A, and virus is made of single protein, which makes about 60 capsid. It is CP capsid protein, abbreviated. So, and actually that structure, complete structure of hepatitis A virion is known as T1 particle. It is electron photo of virus. It has several folds of symmetry, but actually virus looking like some snowy or like that. Again, as we said, usually disease transmitted from ill subject. In rare cases, it can be animals, and the same way of transmission through unsafe food or water. Some cases of blood transfusional hepatitis E are described, and disease actually can be transmitted to fetus if pregnant women again are ill. And symptoms are usually the same, but incubation period can be a little longer. GIT symptoms with liver damage, and the same 3 colored symptoms: dark urine, pale stool, yellow skin, and of course liver damage can be accompanied with hepatomegaly. Diagnosis is the same, and nowadays it is usually a laser kit to identify IgM in acute stage of the disease. As well, we can look for viral RNA which will act as antigen. Specific therapy is not available, and prevention of the disease is the same: washing hands, disposal of sewages, safe water, safe cooking, safe food, and actually it's better to avoid street foods. If subject working here looking some not good, and they don't have any measures of hygiene such as toilets and washing hands. If you see that it is some men working on the street without any option to wash the hands and to go to proper toilet, it's better to avoid any food cooked by that person. So ELISA kit have the same principle. Again, I will not describe, and it can be targeted for IgM or antigen of the virus. And that Chinese vaccine, it is registered as Hecolin trade name. It is the only vaccine available nowadays. It is indicated for adult people 16 to 65 years of age. And again, China usually vaccinate their citizens in endemic areas, and we don't have any vaccine at all.